The shoulder is a complex joint where several bones, muscles, and ligaments connect the upper extremity to the chest. The rotator cuff is a group of muscles and tendons that attach to the bones of the shoulder joint, providing movement and stability to the shoulder. Inflammation of the rotator cuff tendons is called rotator cuff tendinitis, or shoulder impingement. And inflammation of the bursa that surrounds these tendons is called rotator cuff bursitis, or shoulder bursitis. The inflammation leads to thickening of the tendons and bursa, causing space reduction that may squeeze or compress the rotator cuff muscles between the acromion process of the shoulder blade and the humeral head of the arm. This compression results in pain, tenderness, swelling, warmth, and redness in the shoulder. The combined condition of tendinitis and bursitis is called impingement syndrome and is more intense and severe than shoulder impingement. Anatomy. 3 bones, namely the upper arm bone, humerus, the shoulder blade, scapula, and the collarbone, clavicle, join together to make the shoulder joint. The acromion is a protuberance of the shoulder bone or scapula. Ligaments are the thick strands of fibers that connect bone to bone. Ligaments connect the collarbone to the shoulder blade at the acromion process. Bursa is a sac between the acromion process and the rotator trauma, such as overuse of the shoulder joint and muscles, or significant trauma such as a fall. Rotator cuff tendinitis may occur due to bony growth of the acromion process, inflammation of the bursa fluid, bursitis, degeneration of the tendons with age, particularly over 40 years old, overuse injury of the tendons. This occurs more often in people with certain professions and in sports requiring repetitive shoulder movement, such as tennis players, swimmers, construction workers, and painters. Trauma or injury. One hard throw can cause the problem to occur. Diagnosis. Diagnosis involves physical examination by the doctor. X-rays are ordered to nullify other causes of the pain, such as arthritis, or to check if shoulder impingement is due to a bone spur. Soft tissues such as muscle and tendons cannot be seen by X-ray, so an ultrasound or MRI scan may be ordered to see if shoulder bursitis or shoulder tendinitis is involved. Your doctor may give an injection of an anesthetic drug in the space below the acromion to see if it provides relief for the pain. If it does, it confirms that the pain was due to rotator cuff tendinitis or shoulder impingement. Treatment. Treatment generally involves avoiding overhead activities totally for a time to rest the affected tendons and muscles. Non-steroidal anti-inflammatory medicines are given to reduce inflammation and thus help in decreasing pain and swelling. Some shoulder muscle strengthening exercises are also advised. If this does not provide relief, an injection of local anesthetic and corticosteroid, a strong anti-inflammatory agent, may be given in the bursa below the acromion. The condition usually takes a few months to recover completely. If conservative treatment measures do not resolve the problem, your doctor may recommend surgery. The goal of surgery is to create more space for the rotator cuff by removing the front anterior edge of the acromion bone and the inflamed tissue of the bursa. The surgery can be done as an open surgery or arthroscopically. Post operative. After the surgery, pain medications are administered to relieve the pain, and the arm is placed in a sling to allow healing. Your doctor will also prescribe physical exercises of the shoulder to get back functional mobility and strength in the shoulder muscle. Inflammation of the shoulder bursa or tendons can lead to compression of the rotator cuff muscles, resulting in pain and stiffness in the shoulder. The condition generally improves with conservative treatment of oral medications and muscle strengthening exercises. In some cases, a corticosteroid injection is administered in the shoulder. Rarely, surgery is required when conventional treatment doesn't help to improve the condition.